expanding access to doula care. New study highlights mental health and postpartum benefits. The landscape of maternal health care is undergoing a significant shift as the role of the birth doula moves from a luxury service to a recognized component of public health strategy. While doulas trained professionals providing physical and emotional support were once seen as a privilege for the wealthy, recent legislative changes and new scientific evidence are making their benefits more accessible to the general public. The shift toward Medicaid coverage historically, the high cost of private doula services created a barrier to entry, limiting support to those with substantial financial resources. However, a major trend toward institutionalizing this care is underway. According to the National Health Law Program, 26 states and the District of Columbia now cover doula services through Medicaid, up from just 10 states in 2023. With 7 additional states currently in the process of implementing coverage, that number is expected to rise to 33 in the near future. This expansion is crucial because it addresses a systemic gap in maternal health equity. However, a current limitation remains. Most public funding is restricted to hospital-based care during labor and delivery, leaving a gap in prenatal and extended postpartum support that still requires private funding. New evidence beyond physical birth outcomes. While previous research has focused on the physical aspects of childbirth, a new study published in JAMA Network Open has shifted the focus toward the psychological well-being of the mother. By reviewing 22 previous studies, including multiple randomized clinical trials, researchers analyzed the impact of doula care throughout the perinatal period. The findings reveal a nuanced picture of how doulas influence the birthing experience. Key findings of the study: reduced maternal anxiety. The most consistent finding was a significant reduction in anxiety levels during and after labor. Improved postpartum follow-up. Doula support correlates with better engagement with healthcare providers after birth. Higher breastfeeding rates. Mothers with doula support showed a higher incidence of breastfeeding in the early newborn period. No significant impact on pain or C-sections. Interestingly, the study did not find a consistent link between doula presence and reduced pain levels or a lower frequency of cesarean sections. Why mental health matters in postpartum care. The study's emphasis on anxiety reduction is particularly significant for long-term maternal health. While the research did not find a direct, consistent link to the prevention of postpartum depression, the reduction in anxiety is a vital, upstream factor. Lower anxiety levels during and immediately after delivery are closely linked to maternal-infant bonding. A calmer transition to motherhood can facilitate healthier emotional connections. Breastfeeding success. Reduced stress can support the physiological and psychological requirements of nursing. Preventative mental health. While not a direct cure for depression, managing acute anxiety during the perinatal period may serve as a protective factor against more severe postpartum depressive symptoms. The path forward. The growing body of evidence suggests that doulas provide more than just comfort. They provide a stabilizing influence that affects both maternal mental health and infant care practices. As research continues to demonstrate objective benefits for maternal and child health, the pressure will likely mount on both private and public insurers to expand coverage beyond the delivery room to include the critical weeks of prenatal and postpartum support. Conclusion: as Medicaid expands coverage, the focus is shifting from merely assisting in labor to supporting the holistic mental health of mothers. Continued research into these psychological benefits will be essential in driving broader insurance coverage for comprehensive, long-term doula care.